Thank you all for attending today. We have the wonderful Adam Brewer back as a trainer, which we love to work with. And so we're excited about this for today. I'll be here through the entire presentation. My internet can be a little weird, so you might see my video click off, but I'm still here. And I will be checking the chat box. If you have any technical difficulties, questions for me or Adam, I'll be keeping an eye on all of that. So at this point, I will stop sharing my screen here and I will turn this over to Adam to give an introduction and get us started.
Very good. Thank you, Emily. It's good to be with all you this morning. Appreciate you joining for a 4-hour Zoom training on ethics. I have to admit, that's pretty commendable. So appreciate that, and I hope you enjoy the training today. I've been with the Department of Public Administration and Policy for several years now, and my area of expertise is in ethics. So I publish in the area, I teach in the area, and really one of the best, at least for me, one of the most engaging things that I do with ethics is doing these sorts of trainings with professionals like yourself to help you think about how you can elevate your own ethical behavior in your work. And so it's very gratifying to meet with you today. It's one of my favorite aspects about exploring this topic of ethics, and I hope that you gain a appreciation for it as we go through today. Okay, so let's go ahead and we're going to jump right into, I'm going to share my screen here. We're going to jump right into our content. Oh, there's my Zoom screen. Okay, there we go. So, right, so the focus of this training is to elevate your approach to ethics as healthcare professionals. So this training is really geared for those of you who are healthcare professionals, although there are certainly application for those of you joining the training today who perhaps work in county public health or in other fields. This training is a continuing professional development activity approved by the Montana Nurse Association. So if you are a nurse, then it's good you're here. This is an accredited, the Montana Nurse Association, of course, is an accredited approver with a distinction by the American Nurses Credentialing Centers Commission. So for those of you who either attend this training or watch this training, that of course fulfills this requirement. Emily, anything else to add to that I should be mentioning?
No, thank you. I totally forgot about this slide. So yes, just watch. You have to be here for the whole webinar and fill out the evaluation at the end. And then it's worth 3.3 credit hours. Folks that watch it later, so anyone that doesn't show up today but signed up, they have 2 months to do it and can still get credit. So that's all. Thank you.
Okay, yep. I just knew I needed to add the slide. So, all right. So this is our overview for today. It's always good to kind of set out a roadmap at the beginning to understand where we're at and what we're going to be doing. So really how I always like to start these trainings, whether it's geared towards public health professionals or healthcare professionals, nurses and physicians, is really get an understanding of the basics of ethics and make sure we understand what is ethics. And then we get into some of the more advanced terminology and understanding codes of ethics and so on. So we'll follow this model. I like to do what's called a praxis model, where we learn some concepts and some core theoretical perspectives, and then we try to apply them to a real life case. And I think giving you that practice to simulate applying these concepts really helps you internalize them and leave this training with some tangible skills that you can then take with you into your work. So we'll follow this model. Make sure you take notes and also ask questions. I hope that to make this kind of an engaging process for you. And so we will have just a little bit of lecture and discussion, and then we'll send you off into breakout rooms to give you a chance to engage with your classmates in our training today. So let's do a thought activity. I always like to start each hour with one of these thought activities to kind of get our minds thinking about this term ethics. So when you hear the word ethics, write one word or phrase in the chat box that comes to mind. So maybe take a few seconds to think about a word or phrase that comes to mind, and then write that in the chat box if you would so please. And I'll unshare here so I can see. I already see answers coming in. Okay, so P. Whitney, I hope that's, are you okay being called that? Fairness, BRAD says, I like these names. Wow, this group is fun. Aristotle and Nietzsche, very nice. So you're thinking of some philosophers in ethics. Abigail notes difficult decisions. Yeah, in the training, we'll call those dilemmas today. Thanks, Abigail. Bridget notes morals, good. MM12, I really like these code names. These are just great. Also noted morals. Bethany, justice. Yeah, that's certainly a a very loaded term, justice. And we're going to talk just a little bit about that term and how it applies to you as well today. Moral principles. Thanks, Alex. Let's see. INE Hafni, doing what is right. Good, yeah. Real ethics, how we live our day-to-day lives. Oh, that's interesting, right? So perhaps not just what happens in the context of our work, but also outside of the workplace. Very good. Josie notes, I think of BRAD, doing what is right and moral. Good. Integrity, Bridget noticed. And Mary Kay also noted doing what's right. Super. Yeah, those are some great answers there. So I think, at least in the group, I'm getting the sense here in doing this activity that there is at least a foundational understanding of ethics and what ethics means for you. So let's go ahead and jump back in to our screen here. Thanks for doing that activity. So I think it's important that we first define what is ethics, right? And so this is a general definition that I often use in my trainings. This comes from a pretty famous scholar in the field of ethics, James Farah, who notes that ethics refers to well-based standards of right and wrong. So some of you said that, right and wrong, that prescribe what humans ought to do, usually in terms of duties, principles, specific virtues, or benefits to society. We're just going to briefly talk about each one of these four aspects of this definition. So ethics, of course, it's a normative endeavor, right? When we're talking about ethics, it often has to do with standards of right and wrong that are prescribed by our society. And certainly those standards may change over time. I think about the early 20th century during the progressive movement, when there were, during some of the workers, protests and some other things going on. There were a lot of people that were focusing on ethics and some of the corruption that was going on in government and in the marketplace. So since that time, when patronage and all sorts of other corrupt practices were used in government and in the free market, we have really changed in the last 100 years in terms of how we see ethics. That's a good thing, and we should continue to evolve on what standards of right and wrong we prescribe in our work and also in our day-to-day lives. So the four dimensions are duties, virtues, principles, and consequences. Duties, as you see here, really refers to certain obligations assumed when taking on a role or profession. So I'm thinking, in the context of some of you who are physicians or nurses, there are certain obligations that you assume when you take on this profession in the healthcare sector. The behaviors that are expected of those who occupy that role. So really, duties narrowly implies restricted actions that one might be required to take. So think about this. What are some things that might constrain your actions? Certainly in your organizations, there are policies that you must abide by. There are laws like HIPAA that you also, at the federal or state level, that you must abide by in your work as a healthcare professional. You're constrained by those, and so you have a duty to follow those obligations when taking that role or profession. However, broadly, duty is more than just being constrained. It's also about the responsibility to take action, making proposals, investigating, and solving problems in your work. So duties isn't just about being constrained and being boxed into certain actions. It's also about thinking outside of the box and how you can proactively engage in your profession. So an example I like to use is, with my kids, right? Certainly there are laws I'm constrained by in terms of providing a safe environment for my kids and feeding them right and sending them off to school and so on. So I have a duty to, relative to these constraints, to, be a parent, at least according to these laws. But we also, beyond that, have a duty to teach my kids, how to be good citizens, how to engage socially, how to eat healthy foods, right? And so duties go beyond just what we're constrained by. There are also duties that are assumed when we, either assume the role of as a parent or as a healthcare provider, that go beyond just those simple constraints. And I think that's important to note. Virtues, various characteristics that define what a good person is. Some of you mentioned this or had some of the terms that you described: ethics, empathy, kindness, compassion, maybe exercising self-restraint, are all virtues that one might assume when they're in a profession. Certainly as a nurse, there's a certain level of empathy or compassion that you must have inside of you to allow you to be a more ethically practicing nurse. Principles are fundamental truths that form the basis for behavior, the types of actions that are right or obligatory. So with every, and we're going to go later on in the training, we're going to talk about the 9 principles of ethical behavior in healthcare. And so, within your field, there are, principles, specific principles that are unique to the field and that have been identified as really the characterization of ethical practice in healthcare. Principles. So a good example of this might be avoiding impropriety, even the appearance of impropriety. So, one example that I like to use often is, hiring your buddy for a new position in your organization. Even if they are the most qualified, you have to consider, how does that look from the outside? And that's, these are the sorts of considerations you have to make when you are trying to live up to the principles of ethical behavior in healthcare. Avoiding impropriety would be one of those principles that you might abide by. Consequences is the last one. And that is, we have to consider what are the consequences of the actions that we take when we're making a decision. Consequences often refer to actions that produce the greatest good for the greatest number. There are, of course, some critiques to this idea, and that is sometimes, the minority gets left out. So even though, a certain action produces the greatest good for the greatest number of people, there are other people that are left out. And so as healthcare providers, we have to consider what those consequences might be, and which groups are being left out of that greatest good for the greatest number. So that, of course, is what we call a utilitarian principle, and it's often used as we'll kind of challenge that a little bit more here in just a few minutes. So those are our four concepts here: virtues, principles, and consequences relative to this definition that we have given you about ethics. Okay, so I think it's important, considering this definition here, to distinguish between what's ethical, moral, and legal. Some of you use the term moral as a synonym, or maybe when you think of ethics, you think of morality in addition to that, and that is completely normal. But there is some distinctions to be made here so that we understand what the differences are between these terms. So we've already defined ethics. Morality often has to do with distinctions made between right and wrong, and or good or evil. And these are generally related to a reflection of the values of society, particularly when it comes to religious, ethnic, or social group, or of individual conscience, right? So sometimes, and I specifically want to highlight individual conscience. Sometimes, you might make a decision that you believe is the moral thing to do, but within the context of ethics, it may not be the most ethical decision to be made, right? An example I often use of this is, any sort of individual in government that violates the law relative to their own morals, right? And sometimes those decisions might be warranted. Maybe sometimes they're not, but their individual conscience tells them, well, I don't want to abide by this policy or this law, and so they kind of shirk their responsibility within that role to meet that moral I guess that kind of moral position that they're taking in that particular situation. Legal, of course, is within the province of law when something is allowed or forbidden by law. So usually, when we're talking about legality, there's a little bit more black and white there. Although, if any of my students in my class would tell you, they're in the law school, that the law certainly isn't black and white. There's a lot of there's a lot of gray area, particularly when we're talking about case law, and so I think it's important to make these distinctions here, because sometimes these terms are used interchangeably, and we need to understand the difference. Good. So I was just thinking, there might be, one example that I think is important to use here. So you noticed in the training description that we're going to talk about end of life issues today, and interestingly enough, the ethics of assisted physician dying or euthanasia, or however you want to refer to it, changes dependent on the geographic area that you are in the United States. There are some states that have legalized euthanasia, and there are other states that have not. And so the legality and the ethics of euthanasia, it really is relative to where you are geographically, right? So if you're in Oregon, then obviously that is a legal practice with some constraints, obviously, and certain processes that must be followed before you pursue that option for your patient. If you decide to pursue euthanasia in a state that hasn't legalized the practice, then that certainly has ethical implications, right? Because you're making a specific choice to violate the law relative to how you see that issue. Of course, when we're talking about the morality of euthanasia, that's usually left up to individual conscience or religion or other ethnic or social ideas that really toss that volleyball back and forth in terms of the arguments for and against euthanasia. So moving along here, there's this distinction that we need to make. So we talked about the utilitarian principle, the greatest good for the greatest number, right? And really, when we're talking about ethical decision making, there are really two ways of thinking about ethics that we should understand. And this, of course, goes all the way back to some of those philosophers that I think it was T-Rab that noted some of those philosophers. Apologies if whoever that was, I can't remember now. But teleology versus deontology, and it's important to understand these ways of thinking about ethics, because you sometimes make decisions using teleology or deontology without even realizing it. So teleology, also known as consequentialism, is a utilitarian point of view. It's really the belief that the moral worth of an action is determined by its consequences. So, for example, the greatest good for the greatest number. That is a stance that sometimes people take on an issue. Well, this is going to benefit the most people, so this is the best action that we pursue. So, what teleology is telling us is that really what is the best indicator of the ethics of a decision is really the outcome, and not so much the process it took to get to that outcome. So an example is, you might tell a white lie to achieve a positive outcome. So imagine if a murderer comes to your door. I mean, God forbid, that would be just horrible. But imagine that happens, and they ask for your neighbor. And let's just, for the sake of argument, say you like your neighbor, right? I don't know if you like your neighbors or not. Hopefully you do. But let's say they ask for your neighbor. You're probably going to tell them, that your neighbor isn't home, or that your neighbor doesn't actually live there, right? Most of you, I would suggest, would probably tell a white lie to that murderer to achieve a positive outcome, and that's your that's your neighbor not getting killed. Okay, so this is an interesting example here, because it demonstrates that sometimes positive outcomes can be enabled by actions that might be questionable, or a process that might be questionable on ethical grounds. Okay. Now, some of you in this group perhaps would take a deontological approach in this case. where honesty is the best policy, even if the outcome is bad. So, you believe that you should never lie, ever, for any reason. And so you would tell that murderer, oh yeah, he's home sitting in his living room right now. Yeah, I mean, it sounds horrible, right? But the deontological perspective would basically say that there are universal truths and actions that should be taken based on those truths, regardless of the consequences. And so, thinking about your work in healthcare, perhaps there are, outcomes that you don't necessarily prefer, but you follow certain universal principles or truths that ensure that the process of to get to those outcomes, even if they're not the best outcomes, was still an honest process. And so when you're taking a categorical or deontological view on this, you're trying to obey absolute principles all the time. So you can see that there's kind of a balancing act here to be had, right? Certainly you want the process to get to those outcomes to be ethical, but you also want the outcomes to be ethical as well. And sometimes there's trade-offs there. So finally, I want to distinguish between ethical responsibilities and ethical dilemmas. So some of you noted this, difficult decisions, one of you noted in our chat box, and that is very true. So ethical responsibilities are mandates that are clearly spelled out in your organization's policies, the do's and don'ts, and you have the responsibility to follow those policies, right? And if you disagree with those policies, perhaps it would be in your right to, using the means available to question or challenge those policies within the constraints of that policy. So in following the mandates, you can refer to them when making unpopular decisions. And sometimes in your work, you have to make unpopular decisions, right? You have to prescribe a certain treatment, or you have to give patients information that they probably don't want to hear. But your organization's policies require you to be transparent with your patients, and thus, even though it's an unpopular thing, you can classify that as an ethical responsibility because it's clearly spelled out in your organization's policies. And when making that decision, you can say or can state, well, I'm doing this relative to the policies that have been put in place thoughtfully by our organization. So, an example might be protecting patient information and confidentiality. That is an ethical responsibility. Laws and policies specifically are relatively specific now. Maybe the pre-1990s they weren't, but now they are since the passage of HIPAA and other legislation. So an ethical dilemma, on the other hand, is when the issue doesn't involve a responsibility or isn't solved as easily. It's a situation with two or possibly more resolutions that can both be justified using ethical principles. And in our next hour two, we're going to talk about the 9 principles of ethics in healthcare. So both options or multiple options have costs and benefits. There will be those that win and those that lose, unfortunately, or that don't gain as much from the policy. Some groups or individuals will bear those costs, which makes these dilemmas so challenging, because often when you're aware that there will be individuals that bear these costs, it makes the decision all that much more difficult. These dilemmas can rarely be resolved quickly by applying simple rules. They don't have clear answers, and deliberation is often required. So in our training today, we have 4 of these ethical dilemmas, and we're going to go through these at the end of each hour, and you're going to deliberate with your classmates, because really that is one of the best ways to solve ethical dilemmas, is to talk them over, to consult your ethics board at your organization, and to be thoughtful about it. So, an example might be sharing patient information with other providers or other parties to ensure continuity of care. This, of course, has been a discussion in the healthcare field for quite a while now, and that is the lack of continuity of care, and how patient information can be shared in an ethical way, so that patients can have more ease in terms of and receive better care, because other providers are aware of what other providers have been doing with that patient. Okay, so I want to go on too long because, some of you might, it's 9 o'clock in the morning. Some of you might just start snoozing off there. So let's apply this newfound knowledge. We've talked about deontology, teleology. We've talked about responsibilities and dilemmas. We've talked about the four components of ethics, and that's duties, virtues, principles, and consequences. So consider these basics of ethics just discussed as you read the mini case out loud with your group. So what I'd like you to do, once Emily splits you off into breakout rooms, it might be good to briefly introduce yourself to each other, since you're going to be talking with each other throughout these next few hours. And then choose somebody in your breakout room to read the case out loud. And some of you might be wondering, why do that? So why can't we just read it individually and quietly? I think for one, that's kind of awkward, right? It's more engaging for somebody to read it out loud, and then you can read along with that person. So please do that when you get split into your groups and after introducing yourself to each other. The case you're going to read is the case of Megan and Ken. You should have that document available to you. It's a PDF. It should say mini case for hour one. And then discuss the questions at the bottom of the case as a group. If you don't get through all the questions, it's not a problem. So we'll spend about 20 minutes in your breakout room, and then we'll come back together as a class and discuss for about 5 to 10 minutes. So welcome back, everyone. I hope you had a productive discussion. This, of course, is an interesting case. And so let's just kind of chat just about a few things. So I wanted to really address this question here. There's really two questions I want to address in this 5 to 10 minute discussion. And that is, what is Dr. Johnson's ethical responsibility in this case? Is there anyone that we would be willing to briefly give maybe a summary of what your group talked about in terms of this question? What is Dr. Johnson's ethical responsibility?
This is Lee in room 4.
Hi, Lee.
Hi. We think that Dr. Johnson's ethical responsibility was to inform his patient first.
Very good. Yeah, that's a great point. So in terms of like the process that he followed, there were perhaps at least the informing, her husband first relative to her was an ethical hiccup. Okay, other thoughts that other groups discussed? Thanks, Lee.
Just to piggyback off of that, just the getting consent to even tell the husband. She might not want him to know even if she's informed first. So
right. Yeah, so Dr. Johnson made an assumption, right? And that assumption proved to be pretty costly. And so sometimes, if we aren't being thoughtful about, each unique situation, right? Making an assumption that, a husband and wife are okay sharing each other's confidential information with one another, that can prove to be problematic for us in our work as healthcare professionals, right? And so we should always be careful to make assumptions, because that can lead us into, ethical conundrums that we would probably rather avoid. Good.
This is Lee again.
Lee.
In room 4, our group discussed the fact that perhaps the husband had given previously consent for him to be notified, because she has not been to Dr. Johnson in 5 years. And her husband's name may actually be on that form that she had given previous consent to. We don't know that.
Point. Yeah, and it's a good point. And I think that, noticing that case detail is really, I'm really glad your group noticed that case detail, Lee, because a lot changes in 5 years. And, perhaps consent was given 5 years ago, that a lot has perhaps happened since then. And in this case, maybe Dr. Johnson, was acting within the information that was had. And in that case, this wouldn't necessarily be an ethical conundrum if previous consent was given, and they were simply following the form that provided that consent on a previous occasion. Now, if 5 years passes, I'm not certain if that office would have the procedure for them to update their information. That almost seems like you're a new patient again, right? And so it seems like you know, a lot of offices would require you to update your information since it had been so long. You know, that might be, you might consider how the processes of that office might be improved to ensure that, you know, patients are treated as they desire to be treated in terms of consent and the sharing of their information. Other thoughts on this question?
I wanted to piggyback off that. You know, we were thinking about like deontology in terms of, you know, we must act in a way which we will to be universal law without arriving at a contradiction, like going back to Kant. And, you know, if the doc always said, hey, you're going to a procedure, you need a driver, so it's reasonable that you're going to be groggy, you're not going to remember anything. Is it okay if I share some information with the person who you chose to be your driver so that when you get home, you can have that information, you know, relayed to you? And it's reasonable that the conversation like that happened. And maybe, you know, the patient was thinking that I want them to tell me things about, like, can I walk, can I eat, etc. And the doc does not go into that much detail, which is also reasonable because people are quite busy. And it's probably unreasonable to expect a doc to go through a complete checklist of all the different types of information that could be shared. So maybe that is the best way to act. And it would be the responsibility of the patient. So in terms of like utilitarianism, the greatest good for the greatest people, the patient may have already practiced that by ruling out a lot of people that the patient didn't want involved to know anything about this. And when the patient went ahead and decided on her husband as the driver, she was already protecting the greatest amount of people, perhaps.
Right, that's an interesting point. I hope it's okay that I call you B-Rad. That's what's
That's what I prefer to be called.
Okay, good. I like that. Yeah, I think you make some good points there. You know, it certainly would be onerous to expect a physician to have to go through a huge checklist of which information can be shared with the patient, particularly when some of that information might be in their best interest. If they're groggy and can't receive that information after the treatment is given, you know, and they you know, only can really cognitively understand the implications of you know, whatever the prognosis is and you know, whatever you know, further treatment they should be receiving later on down the road, can only be given after they get home and, you know, are you know, come to a little bit better. Then yeah, I think you know, there are some certain reasonable actions that have to be taken, right? And so there's certainly this balancing act between you know, doing things that are in the best interest of the patient, but also, you know, sticking to that principle of honoring autonomy, right? And you know, the deontological perspective would say, you know, you always need to honor autonomy no matter what the circumstances are. Now, this, of course, this situation gives us a kind of a unique situation where you might consider looking at it from a teleological perspective. And so I appreciate your comment there, B-Rad, because I think you know, you and your group you know, characterized that very well. Other thoughts? So let's just tackle this last question and then we'll take a break. This additional question here on page 2 of the case. So physicians and other healthcare providers adopt patterns of behavior that sometimes slip easily into bad habits. No doubt Megan's physician presumed that she would want Ken to know the outcome of the procedure. And perhaps there is some doubt, as some of you noted. How do such habits establish themselves in practice and how are they changed? I'm not sure if any groups got to this point in the questions, but do any of you as individuals have thoughts on this question?
So the way these practices can be changed is through annual education pieces. Yeah, just reinforce these policies that you put in place, an annual review of those.
Good, yeah, so it's certainly a lot easier to change organizational behavior and culture when you do have the capacity to do some professional development trainings where you highlight those policies and remind your employees about what those policies are. Very good, thank you. Other thoughts?
The one thought that I had shared in our group, we didn't quite get to this question, but you know, I'm in Eastern Montana in Sydney, and it's small town USA. And, you know, it's entirely possible that the doctor just didn't even think about it. These might be people that he sees on a regular basis, you know, at school events or at church events or community events, and just never even crossed his mind that, you know, why wouldn't we tell the husband? And I'm not saying that's right. I'm just saying small town USA.
Yeah. No, Kathy, I think you make a fantastic point here. And, you know, as the case noted, that this, you know, most people saw this family as an, you know, an all-American family. You know, they perhaps didn't, you know, what was perceived from the outside was much different from what was going on the inside. And so, you know, it seemed like they kept their, you know, their marriage issues relatively quiet from the rest of the community. And so, yeah, it seems, you know, it seems very reasonable why, you know, either physicians or others in the community would make the assumption that, you know, this couple would want to know about each other's health issues, right? And yeah, I think that's a great point. And it's important to understand the context of when where these decisions are made. At the same time, as you noted, we still have to be mindful that, you know, what we see from the outside perhaps may not be what actually our perceptions might be wrong, right? And we have to sometimes question our perceptions and not make assumptions based upon those perceptions. Very good. Other thoughts?
Adam, I was wondering if that brings up the issue of morality. I know we talked about law and ethics in your question, but like, are there different cultural practices? And I guess there are, just within medicine, you know, a legal and ethical, you know, HIPAA and things that we follow. But, you know, in different cultures, if it's, you know, you always tell the husband, or it's, I was just sharing a movie where I was watching where they withheld that the grandmother had cancer, and they were all like, you know, doing a celebration of life, and thought that, you know, it'd be bad if she knew. So they never told her, but the rest of the family knew. I just didn't know, is that a morality piece, like cultural, or where does that fit in?
Yeah.
I just wasn't sure what term that would kind of fall under.
Yeah, usually when you're, that's a great question, Abigail. And yeah, often when you're referring to kind of ethnic or cultural beliefs that are unique and specific to that culture, that is a matter of morality. And obviously, as a physician or a nurse, you are sometimes will butt up against what you believe to be ethical practice relative to what morally that group sees as the right decisions for end of life issues, or, you know, confidentiality issues, and so on. You know, perhaps there are, you know, certain norms they have in terms of gender that are seen from a moral lens, but you know, you approaching it from a different lens, you know, might see a better, or at least in your mind, a better way of going about it. And so you do have to be careful of those, you know, cultural and ethnic contexts, right? In fact, we'll address this issue a little bit later on in the case. I think this is our last case of the hour, of hour 4, where you will kind of see this come into play. And so we'll chat about this a little more and see if we can kind of tease out some of these ideas. Good. Okay, well, I think we've been going for about an hour now. So I think this is a good time to take a break, take a breather. So we'll step away for about 10 minutes, 5 to 10 minutes. So come on back after you've had a chance to take a break, and then we'll jump into our second hour. Thanks, everyone. Let's see. Okay, so we had our 10-minute break. So let's do another thought activity here real quick. So we understand the basics of ethics, right? And some of those, you know, kind of broader ways of thinking about our decision making as healthcare professionals. So the next question I want you to think about is why? Why should healthcare professionals act ethically? What's the point in acting ethically? So take just a minute or two to think about that, and then write an answer in the chat box. Why should healthcare professionals act ethically? Okay, good. Looks like we got some answers coming in here. Mary notes, that's what's expected in our profession. Good, so there's an expectation. Mary, think about, where's that expectation coming from? That's a really interesting point you make. Kathy notes a professional duty or requirement, a duty. Thanks, Abigail. Good. Christy notes it's a standard of practice. Fantastic. Any other thoughts? Josie noted because of the impact it can have on others. Good. So we act ethically because you're thinking about outcomes right there, Josie. BRAD notes because healthcare professionals are ethically bound. Yeah, so there's a certain, I mean, we all know about the Hippocratic Oath, which we'll talk about here just briefly in a second. P. Whitney notes, we get into this profession because many of us have a calling. Good. Yeah, BRAD noted a code of ethics. Very good. Okay, yeah, great answers there. I particularly appreciate the focus on a professional duty or an expectation, and I think that that certainly characterizes what we're talking about here. Let me share my screen here again. Yeah, so healthcare ethics involves making well-researched and considerate decisions about medical treatments while taking into consideration the patient's beliefs and wishes regarding all aspects of their health. The industry, above really any other, has a high regard for the issues surrounding the welfare of their clientele, particularly their patients. So unlike any other, business or nonprofit or government entity in any sectors of the economy, healthcare really has a particular interest in that. So doctors and nurses, other professionals who work in healthcare have the ability to affect a patient's health, are all forced to make ethical decisions on a daily basis. There's a great quote here that I want to share with you. This is from Bate Amer in an article published just a couple years ago. Patients in society should be confident that difficult choices are not dealt with in an arbitrary fashion or simply dependent on the particular moral stand taken by clinicians, right? So we're talking about, right, sometimes you as a professional take a moral stand, and patients really should be confident that you're not simply making decisions particularly based upon your own personal morals necessarily, but on broader ethical grounds. Choices should be made or presented fairly and usually in the best interest of the patient. Ethics is just as much about how dilemmas are resolved than with what the right choices or actions should be. So thinking about process here. Central to modern clinical ethics is the dignity and respect for the patient as individuals capable of understanding and where possible taking decisions about their treatment. So I think that encompasses some of the principles that we're going to talk about here. Let me just check. Good, yeah, so Bethany noted the Hippocratic Oath, first do no harm. And beneficence, thank you, which we're going to talk about here in a second. Yes, do no harm. Wonderful. Okay, so here are the 9 principles of ethics we're going to talk about. And there's certainly more beyond this, but I think these 9 really encompass much about what the expectations or duties that you are responsible for as healthcare professionals. So we're going to talk about these. Some of these you're probably familiar with, I would suspect, and maybe some of these you aren't. And so I think it's good that we review these together as a class. So the first one is non-malfeasance, right? This notion of doing no harm, even if the patient requests it. This, of course, requires an intention by you to avoid needless harm or injury that can arise through acts of both commission and omission. So it really requires you to be thoughtful and think about the decisions you make and the degrees of harm that would be replaced with greater or aspects of harm. So there are trade-offs in the decisions that we make, and sometimes there are higher levels of harm or lower levels of harm, and we have to be able to distinguish what those are. So an example might be informing patients of the potential for side effects to various prescription medications, right? Certainly it's within your ethical purview to make a patient aware of those potential side effects. Even though most of the time those side effects, the probability is very low that those side effects will occur. at the same time, in providing that treatment to the patient, chances are they will benefit from that treatment and not be harmed by it, but there still is a low probability that they may be harmed by it. And so we have to think about, distinguishing those degrees of harm and the trade-offs that are sometimes involved in the decisions that we make. So in thinking about like application to you, in order to honor this principle of non-malfeasance, there are really two questions you can ask yourself. And I invite you to take special note of these questions. First, will no one be harmed by the proposed intervention? And secondly, are especially children prevented from harm? Children often can't speak for themselves, as they're, certainly in terms of politics, an underrepresented group. And so it's up to us as adults to speak for children in their best interest in the best way possible that we can. And so these are really two, important questions to ask ourselves. Now, of course, in that first question, will no one be harmed by the proposed intervention? Again, sometimes there are smaller levels of harm that are traded off for lower or higher levels of harm, and that certainly should be acknowledged. The next principle is beneficence. This is the obligation to not only do no harm, but to actually produce benefit, okay? So even though non-malfeasance is an important ethical principle to consider, beneficence is kind of just a step above that. Physicians and nurses should heal and help their patients and make an active contribution towards the welfare of others. So it's one thing to have the goal to not cause harm to anyone, and that is a valuable goal. But also making an active contribution towards, benefiting the lives of your patients and improving their lives is really kind of a next step up from that. And that's why beneficence is so important. It's not coercing or manipulating patients into making decisions against their values, however. And that's important because sometimes treatments that might, benefit the health of that patient may violate that patient's morals violate their values on moral grounds, so to speak. So questions to ask yourself. Again, make special note of these questions for practical application. Is the intervention of any good to every single is of any good to every single person taking part in this intervention? Of course, we all know that various treatments influence or people respond differently to the same treatment, right? And so, of course, all treatments don't have 100% level of beneficence, so to speak. Overall, for both non-malfeasance and beneficence, is it possible to assess whether more benefit than harm is produced by intervening or not intervening? And if so, on what side, benefit or harm, does the equation finally fall? So again, as physicians or nurses, sometimes we have to consider this balancing act, right? Will this intervention cause more harm? Will it cause more benefit? There's trade-offs there, and we have to consider those trade-offs as we, make decisions that are unique for each patient that comes before us. So the next one is justice. Justice is an important principle that we really should consider in healthcare. All persons have equal moral worth and should be treated equally, as this principle would argue, without bias by healthcare professionals. Care must be fairly, justly, and equitably distributed among a group of patients. And so thinking about this individually, consider, do you treat patients differently based upon outward characteristics, right? Age, gender, race, religion. And so you have to consider if you are going to treat patients differently, you really have to address those decisions with a certain level of strict scrutiny, which is really a legal term that the court often uses when laws distinguish differently between people of different races or genders, for example. Similarly, you as an individual, if you're going to treat a patient differently, and obviously, relative to the patient's age or gender, there are certain, you might, offer different treatments relative to those characteristics. But in terms of the quality of care that you're providing, should be provided fairly and justly and equitably among a group of patients that you are seeing on a regular basis. So questions to ask yourself. Is no one, including third parties, stigmatized, discriminated against, or excluded as a consequence of the proposed intervention? Is the institution that you're working for proposing the intervention publicly justified and acting transparently, right? So it's important that the institutions that we work for and in our practice, we are operating transparently. You never want to give, as we noted previously, the appearance of impropriety. And usually that comes when there's this perception that you're trying to hide what you're doing. Does the intervention consider and support vulnerable populations? So, migrants are an example of that. Are migrants that come in your office, are they treated differently, than other patients that you see? And so it's important, and these are tough questions to ask, but it's important that we ask these questions. Do we treat people differently or don't give them the same quality of care relative to their characteristics? And even though, again, these are sensitive issues, it's important that we tackle them head on as healthcare professionals to improve the care that we provide to our patients. Fourth is respect for autonomy. As some of you may have noticed in our discussion about non-malfeasance and beneficence, there's kind of a paternalistic element to those two ethical principles. So the paternalistic benevolence contained in the principles of non-malfeasance and beneficence is strongly tempered by the emphasis on respect for autonomy, right? So you're all educated. Many of you have gone to medical school or nursing school or participated in other training. And sometimes patients want to do something differently than what you've been trained to guide, patients in. And so that respect for autonomy of the patient sometimes overshadows, your desire to cause no harm, right? A patient may sometimes want to do something like, smoking. You tell them not to smoke and they want to keep smoking, right? It's bad for their health, but they, will not give it up, right? So, respecting the autonomy of the patient and working with them within the context of their particular situation is important. So questions to ask yourself, and there are several here, my apologies, but these are really good questions to consider as you honor this ethical principle in your own practice. Does the intervention refrain from employing coercion and manipulation? Does it foster free choice? Is there really informed consent to take part in this intervention? This is particularly true with children, that you have to consider, but also with patients that are near the end of life or are in other compromised situations. Is self-responsibility not only demanded, but also possible for every person? Are privacy and personal data respected? If the intervention is paternalistic, is this justifiable, right? And so we often have to think about, so I have an older brother, who's a physician, and it seems like we've talked in conversations about, the quote unquote God complex that, physicians or other practitioners, have in terms of having all the answers. And it's really important that, you have to think about whether or not, you're imposing paternalistically on your patients, and whether or not that's justifiable or not. Does the intervention promote the exercise of autonomy? And so that's, in terms of respecting the autonomy of the patient, we always have to consider whether or not interventions are not simply like honoring or respecting autonomy, but also promoting the exercise of that autonomy, where patients have all the information and can make informed decisions relative to the information that you have given them. Ultimately, the highest degree of freedom or autonomy that comes in our practice as medical professionals would be in patients having all of the information and being able to make the most informed decision. Fifth is health maximization. So we talked about beneficence and non-malfeasance, and really those two principles involve micro encounters generally right? So how we individually interact with our patients. But what about consequences or the greater good for the greatest number? So, in considering how we practice healthcare, we're often involved in these micro encounters. It's difficult to look at the broad picture. So health maximization is about producing benefit in a wider sense. So an example is the opioid epidemic, is ultimately derived from millions of micro encounters between patients and physicians. Certainly, in all of those micro encounters, physicians are trying to help their patients by prescribing opioids, for whatever condition that patient is experiencing. But in the aggregate, all of those micro encounters put together have at least, based upon, recent information, have been demonstrated to produce a quote unquote epidemic where, individuals are abusing the opioids that they're being prescribed. And so that's, as physicians, we have to consider the implications of the decisions we make in these individual micro encounters with patients in the broader context of those decisions. So consider what role you play in maximizing health for the public at large. So questions to ask yourself. Is the proposed intervention effective and evidence-based? Does it improve population health overall? Does it have a sustainable long-term effect on the public's health? Is there a community added value to the proposed intervention? So this, of course, these are tough questions to think about as you're individually, dealing with individual cases on a daily basis. But these are important things that we really have to consider, right? Because, we want to make sure that in the aggregate, what we're doing for our patients is also good for the population at large. Okay, so I hope I'm not moving too quickly here. So our sixth principle in ethics. So appreciate you staying with me here. I know this is 9 is kind of nine is still a big number to me. And so make sure you're taking notes here and you can review those to remember each of these principles. All healthcare systems lack resources. You're probably aware of this. In your organizations, there's always probably talk of scarcity, budgets that can't supply the needed amount of resources to operate successfully. These are discussions that take place in many organizations, health organizations all throughout the country. So as a result of this, there is always a need to be more efficient. More efficient use of resources means more people served. So questions to ask yourself in terms of honoring this principle of efficiency, because it's important that we are helping our organizations operate in the most efficient manner so that we can help more people. So is the proposed intervention cost effective is one question that we should ask. This is an important question to ask because, of course, some interventions are going to be more costly than others, both for the patient, for the insurance companies, and for the organization. And so it's important that we consider this. Now, of course, efficiency may come into conflict with non-malfeasance and beneficence. So I hope you're beginning to see that as we talk about these principles, that sometimes they have the elements of each of these principles may conflict with other principles. And we're going to talk about that a little bit more. Secondly, awareness of scarcity of public money. Saved money can be used for other goods and services, right? So this isn't so much a question, but simply being aware of the scarcity of funds and the importance of saving money for organizations so that we can produce more benefits, more good for a greater number of people, so to speak. Okay, accountability is number 7. Accountability is accepting responsibility for one's actions. Pretty simple, right? But humans have a tendency to not want to accept responsibility for our own actions because that means sometimes we have to acknowledge that we were wrong, and nobody likes to really do that. For example, nurses are accountable for their nursing care and other actions. They must accept all the professional and personal consequences that can occur as a result of their actions. The same goes for physicians. So questions to ask yourself: what consequences may occur resulting from this choice that I'm about to make? Sometimes we make choices and a lacking, thoughts, so to speak. And we should be more thoughtful in ensuring that, the choices we make don't have, far-reaching consequences. But if they do, then we obviously have to accept accountability for that. Will this choice be perceived as unethical by others? So sometimes, we have to think about, what a decision means for our organization. So again, this gets back to the notion of avoiding even the appearance of impropriety. Sometimes we have to ask ourselves the question, what if my, grandma or my mom saw me doing this? Would they question that? What if what I was doing right now was reported in the news media, in the New York Times tomorrow, or in the Missoulian, right? How would I feel about that? Chances are they wouldn't report it in the way that, as I imagined it in my own mind. So you always have to think about perception. You don't want to be preoccupied by this, because you can't really live your life if you're sitting there preoccupied, like, oh, what if this was reported in the news media? But it's a good question to ask yourself, because avoiding the appearance of impropriety will not only benefit you in terms of your career, but also, help your organization, stay out of hot water, so to speak, and have to answer to the public and to, the media and to politicians who often have other agendas that aren't in the best interest of your practice. Number 8, fidelity. Fidelity is keeping one's promises. I know this may seem relatively simple, but I feel like sometimes we fail to honor the commitments that we make on a regular basis. So for example, a nurse must be faithful and true to their professional promises and responsibilities by providing high quality, safe care in a competent manner. So questions to ask yourself: when I make a commitment to a patient, even something as little as I will return in 5 minutes, do I keep that commitment exactly as articulated? Our patients, trust in the commitments that we make. And so when we violate those commitments, we violate the trust that we have with our patients. So it's important that we honor the ethical principle of fidelity, because it allows us to ensure that the public continues to trust the work we're doing. Finally, the 9th principle is veracity. Veracity is being completely truthful with patients. Nurses must not withhold the whole truth from clients, even when it may lead to patient distress. This, of course, gets back to this idea of ethical responsibilities. And sometimes it's difficult to tell patients information that we know they would rather not hear. But it's important that we are completely truthful. So, a question you might ask yourself is, when I clarify treatment options, do I share information in a transparent way so as not to dissuade or manipulate the patient towards one option or another? So again, giving our patients full autonomy means that we're honoring the principle of veracity. We're being completely truthful with our patients. This, of course, is true for nurses, physicians, and others that a patient might interact with as they pass through our organizations. Okay, so before we get into our next case, I want to make sure there's no questions. We kind of cruised through some of those 9 ethical principles. Are there any questions that anyone in the audience have before we try to apply some of these principles to a case? There's an interesting question here. I didn't catch this question from BRAD. Is there room for equity and justice? That's a really big question there, and I think there's yeah, I would say yes to that question. The challenge is justice is one of those questions that philosophers have been debating for 3,000 years. What is justice? And I don't know if that's a question we can quite address in this class that broadly, because again, your point of being here is to find practical ways of applying elevated ethical behavior to your work. But yeah, we certainly have to think about equity, particularly when certain groups in the population have different outcomes. And we have to ask ourselves the question, are those disparate outcomes resultant from our actions? Now, sometimes disparate outcomes are not a result of the system, but are a result of personal choices, or other variables. But we as professionals should still ask ourselves the question, are those disparate outcomes resultant from our organization and the processes we have in place? Yeah, P. Whitney agrees as well. I think yes, BRAD. But that's a great question. Yeah, I tried to address it as good as we can in this class, but it's a kind of a broad philosophical question. Okay, well, let's go ahead and then jump into our next case. So the next case we're going to do is the case of Melinda and Matt. I'm excited about this case. This is actually a tough one, I feel like. So already we're getting to a difficult case here in hour 2, but I'm confident your groups can do this. So consider these 9 principles, as we just discussed, as you read the mini case out loud with your group in the breakout rooms. We'll again take about 20 minutes. Again, I invite you to enable your video screen if possible, and talk actively with your group members. There are a few questions at the end of this case, and so please take some time to discuss those questions. If you don't get to all of them, that's okay. And then we'll come back together as a class and discuss these questions and try to apply these 9 principles as effectively as possible. Now, I heard some of you say like, oh, this is a tough case. This is a hard one. And I do acknowledge that. This is a difficult case. But I think it's very illustrative, again, of these pitting of these ethical principles against one another. And so let's go ahead and just establish as a class. So you had a chance to kind of establish this in your group, but let's see if we can come to terms with this as a class. What is the core ethical issue here? So let's tackle that first. What are some thoughts? So what did your groups come up with in terms of the core ethical dilemma that we're facing in this case? Let's
This is
see.
Lee.
Go ahead.
Hi, this is Lee from room 4. We
Hi, Lee.
discussed fidelity versus veracity, keeping a promise versus the complete truth.
Yeah, good. So this is a good. So you noticed this idea of fidelity versus veracity is a core ethical dilemma, right? And these 2 conflicting principles in terms of telling the whole truth and then making a commitment to a patient. And you can see that like a tacit commitment was made, prior to her condition deteriorating. Interesting point. Okay, other thoughts?
One person in room 4, and I can't remember who it was, Kathy, I don't think it was you, brought up the point that the promise could be kept by putting the baby physically on the mom. And that was a really excellent point, we thought.
Interesting. So yeah, you were already kind of thinking about like potential alternative solutions
Resolution.
to this dilemma. Interesting. Okay. Thanks for that, Lee. So Abigail, I noticed you unmuted there for a second. So what did your group decide was the core ethical dilemma?
I was in Lee's group, but I think
okay.
the other piece too is just the I don't know the word of the 9 principles, but not the doing no harm, but like, are we doing good? Too?
Yeah, beneficence.
So, beneficence.
And no,
yeah.
there was someone else who noted they didn't like pronouncing that word, beneficence.
Yeah, Kathy. Yeah, I got around that one. Thanks, Adam, for filling. I just can't remember what the word is. Yes.
Yeah, I think so. There's certainly you certainly see a conflict there, particularly with respect for autonomy and beneficence, right? I think is where you see a core ethical dilemma in this particular case. Good. So we've identified a few core dilemmas in this case. So my big question that I wanted to kind of ask the group before we go to our next break is, how do we in addressing this case, which value do we believe is the key principle, or which ethical principle is the key principle. And if you believe that there's one that we should adhere to the most, strongly, how can you make the argument that this principle should be valued more than the other conflicting principles in this case? And I can't remember which group, I think it was Bethany's group that, not to point out, that had some interesting thoughts on this one.
So, we kind of thought that ultimately, I think that the most important principle that is required to be upheld in a situation like this is non-malfeasance. You need to ultimately make sure that what you're doing to the patient is beneficial. And as long as the patient's autonomy is in line with that, I think that there isn't necessarily an ethical dilemma. But when those two values go head to head, I think that's when you run into a situation. And I think that comes down to one of the questions further down in the sheet, which was about futility. It's whether or not you believe that care that you're giving that patient is futile, in which case you could argue that you're violating the principles of non-malfeasance.
Right. So when thinking it, so Bethany notes, an emphasis on respect for autonomy. And when a patient makes a request, it makes it easy to see that as an ethical responsibility rather than an ethical dilemma when you're simply respecting the autonomy of that patient. Now, of course, you have other intervening variables at play, like the patient's parents and sister, and the father as well, which make this challenging. I wanted to give B-Rad, if you wouldn't mind me pointing you out. So no one's mentioned efficiency yet, and B-Rad made an interesting point about how the ethical principle of efficiency applies in this case. Would you mind sharing your thoughts there with the rest of the group?
Yeah. So kind of when we take this and look at it beyond the individual family and situation, and we look at more of like at the whole healthcare system, we talk about efficiency and how much resources are being, tied up to pay for this patient. And I'm not saying, that we need to pull the plug, but at what point do we start looking at the cost of how much this is and how much that is affecting the whole system? We know that the American healthcare system pays more money per capita than any other nation worldwide, yet our outcomes are garbage. So we really need to reevaluate our spending. And, that also ties into like a larger social justice picture, looking in terms of, what is the socioeconomic status of this person? Is this a wealthy family, middle class? Are they poor, minority? And, if this was some uninsured, poor minority patient, would they be getting the same, in terms of equality? Would they be getting the same opportunity to make the decision?
Right. Thank you. Go ahead.
This is Kathy. I'm going to jump on that too, because we had talked about that in our group as well. But I think B-Rad mentioned something I hadn't even gone to in terms of the whole level of the healthcare. So if we continue on this road, are we going to reach a point in time when the payer, whether that's an insurance company or whatever, will no longer provide care at the acute care setting because we've plateaued or whatever? And now we need to look at moving this patient somewhere, and where's going to take her? And obviously she can't go home. And there's just a whole, boy, he just did the tip of the iceberg. There's a whole cascading level of questions and issues that come in on that whole efficiency piece. So yeah, good job.
Yeah, I appreciate both of those sentiments. Thank you. I think in considering this case, it's difficult, and even though this is a difficult case, there are many principles at play here that we have to consider in making this decision. And this is a difficult decision, and it has far-reaching implications, both for this individual family and thinking about health maximization for society. So really, like, it almost all 9 principles apply in this case. That's what makes it such a good case. And so I hope that you consider moving forward and we're gonna, in the next hour, we're gonna talk about the 9-step process of ethical reasoning to kind of help you think about how you can approach these situations using that process of ethical reasoning. Because there are so many principles at play, it's nice if we have some kind of process that we can go through to help us make sense of all of these intervening variables that are present in this case. Okay, so that's I think that'll be a good place to stop for now. We've been going for about an hour, so I think a break is warranted. So let's go ahead and take another 10-minute break. We'll come back at about 11:20 here and begin our third hour. Thanks everyone for the great discussion. We'll see you in 10. Good, well, it's good to be back with everyone. Hope you had a chance to refresh a little bit as we continue in the second half of our training today. So we've had a chance to talk about the 9 principles of ethics. And I think this discussion, after we had our class discussion there at the end of the last hour, warrants thinking about how we actually make ethical decisions, or the process of reasoning we go through in making these really tough calls sometimes. So we're going to chat about that. Before we do, I just want to, let me share my screen here again. Give me just a second. Okay, let's come back to our slide here. Okay, so you've had a chance to take a break. All right, so let's do another thought activity. So in your mind, what are some of the most pressing ethics issues in healthcare today? We've talked about a couple so far in our training, but what are some of the most pressing issues that you see apparent in healthcare today in terms of ethics? So take a few minutes, or just a few seconds, excuse me, to think about that. And then please put an answer in the chat box if you would be so kind. Let me stop sharing here so I can look at the chat box a little bit more. Okay, COVID. Yeah, thanks, Abigail. That is a pressing issue. So we're talking about the transmission of disease. And I'm putting COVID in a broader context, but disease transmission is one. The vast majority of healthcare spending occurs at end of life, particularly for the elderly. Yeah, thanks, Bethany. It's a good point. We do have to think about the efficiency aspect of those issues. The COVID vaccine. Thank you, P. Whitney. Lee has noticed equity plus accessibility, justice. Okay, good. Yeah, so certainly there's certain treatments that aren't as accessible to some segments of the population versus others. Mary Kay Burns notes efficiency. Sorry to say your full name. My kids, when I say their full name, they know they're in trouble. So it sounds kind of weird. Sorry, Mary. Efficiency of our system. Yeah, thank you. That's a great point there. Other thoughts? Autonomy versus social contract. Thanks, B-Rad. Yeah, that's a good point. Inefficiency. Good. Yeah. So there's certainly a focus within this group. There's a focus on the efficiency aspect of our system. I'll just share just a few here in my list. If you would. So well, I shouldn't say a few. There's several. So patient welfare, of course, is one that we deal with when we're talking about beneficence and non-malfeasance. Privacy and confidentiality. The protection of private patient information in the medical field is one of the most important ethical issues that may arise in the field of healthcare, particularly conversations between patients and a doctor, which are strictly confidential, and access to them is strictly monitored. Continuity of care. There are certainly challenges that you face or obstacles of care continuity, including patients not having continuous healthcare coverage, difficulty in patients making appointments, and problems with electronic health records that prevent communication between physicians and providers. So that certainly is a big issue that is being discussed, I think, more and more in healthcare, at least in the last decade. Providing information is another one. Certainly, among ethical issues in healthcare, this is one that can never be given too much attention. the information that hospitals provide to advertising companies, is something that should be discussed. Elderly patients, so dealing with patients with advanced age, I think a couple of you noted this issue. Sometimes it poses problems in regards to ethical decision-making, since they often aren't capable of making rational decisions on their own. The same goes with terminally ill patients. May have specific wishes for the manner in which they want their life to end. Relationships and sexual harassment. If you don't mind, I'm just going to do kind of a quick side note on this one. So in our program, I teach the HR class, and we actually spend a whole week on sexual harassment. And sexual harassment is actually a very prevalent issue, particularly in the legal field and in the medical field. There's a number of reasons for that. And so as an HR guy, I can't help but at least do one slide on this issue. Now, this is from the American Medical Association Code of Ethics, and I think it's important to review this. A physician, and I'm adding a nurse to this, must terminate the patient-physician relationship before initiating dating, romantic, or sexual relationships with the patient. Likewise, sexual or romantic relationships between a physician and a former patient may be unduly influenced by the previous physician-patient relationship. Sexual or romantic relationships with former patients are unethical if the physician or nurse uses or exploits trust, knowledge, emotions, or influence derived from the previous professional relationship, or if a romantic relationship would otherwise foreseeably harm the individual. In keeping with the physician's ethical obligation to avoid inappropriate behavior, a physician who has reason to believe that non-sexual, non-clinical contact with a patient may be perceived as or may lead to romantic or sexual contact should avoid such contact. So I think it's important to point this out because unfortunately in popular media, there are like several TV shows that normalize this kind of patient or sexual harassment and the kind of relationships that should be avoided in terms of relative to the AMA Code of Ethics. And so I just wanted to quickly make note, please avoid these kinds of relationships. They really can make your life very challenging. The same goes with relationships with coworkers, and it's likely your organizations have policies in place that regulate those kinds of relationships. So it's always worthwhile to review those policies to make sure you're in line with the policy, but also operating in an ethical way. So just wanted to give a quick slide to that one because I think it's important. Unfortunately, popular media kind of normalizes it. But usually it leads to really difficult, challenging situations that often have legal implications and can leave somebody and really increase liability for the organization and for the individual. So there's that. So a few more major ethical issues in healthcare. We talked about transmission of diseases. So one of you mentioned COVID. A couple of you mentioned COVID. Balancing care quality versus efficiency. Thank you, BRAD, and others of you who noticed this issue here in terms of ethics. Therapies, aggressive marketing practices. So, when hospitals market particular treatments, where's the balancing act between, trying profitability versus, providing the right care for patients and others. So there are others, but I think these are important to know. So, because there are so many dilemmas that you face on a regular basis, perhaps daily, it's important that you understand this 9-step process we're about to go through of ethical reasoning and be able to apply it when you confront challenging ethical dilemmas. And so we're going to go through this process in the next few minutes, and then we'll give you a chance to apply it in another case study. So let's just do a quick test case here to kind of help us illustrate this 9-step process. So Maria Morales, head of the Infectious Disease Control Unit of the Department of Health of the County X, and I noticed that some of you are county public health professionals, and so I think this will make it relevant to you, is asked by her supervisor to make a recommendation if measles immunization should be made mandatory in their region as recently 2 children died after a measles outbreak. County X has an insufficient immunization rate, first dose at 70% and second dose at 55%. Maria finds out that obligatory measles immunization is effectively implemented in other states and counties. She knows her supervisor is taking her advice most seriously. What should she do? So the first step in our 9-step process is to identify and frame the ethical dilemma in your own words. So we did this with this last case. What is the core ethical dilemma or dilemmas in this case? Well, there are a couple that we might be able to identify in just kind of our own thought process in our own words. I would suggest that potential core conflicts include, can a parent's right to not have an intervention done with their child be overridden by the state for someone else's good, perhaps? So that question is one dilemma that I think, as the COVID vaccination is produced and implemented more and more in our country, that is a question that many states will be confronting in the relative future. Can parents exercise their will on behalf of their children? I think is another potential core conflict that is resultant from this case. The next step is to identify and frame in ethical words. So you now identified it and framed it kind of in your own words. Now let's frame it from the principles that we just talked about. So what ethical principles are relevant and do they conflict? So overall, I would suggest that principles respect for autonomy and health maximization seem to be affected and seem to mutually exclude each other. I see a comment here. Let me just, good, yeah. So let me just go backtrack here. So yeah, inefficiency in the system. Okay, so yeah, Greg noted, not ethical, it is a legal question. And that is a good, yeah, and I think so, Greg. And relative to like public policy, many states are grappling with this question, or they have in the past. So particularly in states, so you had that outbreak at, I think it was a measles outbreak in Disneyland a couple of years ago in California. And California had to grapple with the question, do we get rid of religious or personal exemptions for measles vaccinations? And after that case in Disneyland, California actually passed legislation getting rid of personal exemptions, I believe, like philosophical exemptions. I can't recall if they got rid of religious exemptions or not. I think they did, but it was a few years ago, so I can't remember. So it is certainly a legal question, and I would suggest also an ethical question relative to when decision makers have to decide whether or not mandatory vaccination is, thinking about it from the principles of ethics. Good. Okay, so what ethical principles are relevant and do they conflict? So one has to ask whose autonomy is at stake. We have parents' autonomy, but what about the future autonomy of children as well? Furthermore, the immunizing doctor might be indecisive whether to advocate for autonomy, health maximization, or non-malfeasance. So you can see in this case, there are some conflicting ethical principles that conflict with one another. And so we want to identify and frame this in ethical words. Okay, the next step is to gather more information. Do I have all relevant information? Can I get more background information to understand all the particularities? So this is really the research stage. If you are able to, it's always good to step aside after you've kind of identified the core ethical problems or conflicts and to gather more information where possible. So some questions you might ask in gathering this information are, what are the potential side effects of measles immunizations? How severe are measles for children? About how many persons to be vaccinated against their parents' will can be protected? Which effect would there be such an immunization program have on the incidence of measles? And which side effects could actually be prevented? So these are, you really want to think about what other questions need to be answered before I can, really proceed in this decision-making process. Step 4, consider alternative solutions. Are there other alternative solutions that are feasible with less moral issues or costs? So, sometimes, there are solutions that might value the respect for autonomy, but still give us good outcomes. And so we certainly want to consider those. So in this particular case, can there be alternative approaches to mandatory measles immunization? Can one raise immunization rates by informing or educating, advertising, or setting other incentives for parents? So sometimes, when we're thinking about our practice or even just public policy in general, we often think about solutions in terms of hard power, but there's sometimes more soft power methods that can be used that honor the respect for autonomy, such as educating, advertising, or creating incentives for parents to bringing their children in for measles immunizations. So we consider alternative solutions. The next step is to specify the alternatives further. So do the specifications change with more information? So again, in making decisions ethically, it's important that we consider new information, that we don't just block out information sources, or we don't consult with anyone, but that we make it a deliberative process. If there are alternative ways that are less infringing on the respect for autonomy, but rather support the health maximization and the protection of those who cannot be immunized, thinking about non-malfeasance, then these alternatives may have a higher ethical value. And I emphasize that word may, because again, this would be relative to the context here. But in this particular case, there's a possibility that in thinking about alternatives that infringe less on the respect for autonomy and support health maximization, those certainly might be considered. Sixth, we have evaluating alternatives. So this is when you actually think about the alternatives that you have, or the options you have available to you, and kind of running them through the ethics of each one of those decisions. So are all conflicting principles and their specifications still of equal value? If other measures like incentive setting, education campaigns for immunization can be successfully implemented elsewhere, mandatory immunization seems less necessary. And I say, again, I kind of emphasize, seems less necessary, but in some contexts, perhaps that wouldn't be the case. Yet autonomy of parents who are safeguarding the autonomy of their children may attain even more weight. So we do have to think about, now we're kind of thinking about these conflicting principles and making a decision about, which conflicting principles might have more value or might be weighted more differently than other principles. Finally, we ultimately have to come to a conclusion, right? So we've, in evaluating alternatives, we're kind of justifying why we're making the decision the way we're making it, and then we come to a conclusion. So what do I conclude from the specification weighing? What would be my solution to the problem? So perhaps the solution would be mandatory measles immunization would, in this particular situation, not be necessary in order to achieve the best outcome. And given that it would infringe, on the autonomy of parents and allegedly that of children, it should not be applied. So this is a potential conclusion that you might come to, considering the alternatives and the evaluation of those alternatives relative to ethical principles. So the 8th step, after you come to a conclusion, is the integrity test. So can I personally accept the conclusion drawn, right? So thinking about an intervention with the patient, perhaps you decide to to go with, to value the autonomy over most other principles or non-malfeasance. Can you personally accept the conclusion drawn in this particular test? Does it violate your integrity, so to speak? It seems to be a suitable solution, right? So thinking about this public health case at first try, so consider trying other measures rather than being in charge of forcing parents and children to have their children's bodies, quote unquote, invaded against their will, so to speak. And so again, you have to think about whether or not this decision you're coming to, can you personally accept it? Maybe it wasn't the first thing that came to your mind as you approach this process, but is it a solution that you can accept? And then finally, the last step is to act and convince. So I act according to my judgment and convince colleagues and others based upon ethical reasoning, okay? Now, Ideally, hopefully, you've already deliberated with colleagues or your ethics board, so that you can, so that your argument is more convincing, that I've come to this conclusion and I'm acting in this way for these reasons. I try to find resources within my professional budget and start action to promote immunization with other means. That would be how you would act and then convince in this particular test case that we're dealing with. So this is our 9-step process. Now, 9 steps is kind of a lot. So I like to kind of narrow these down really to 3, more 3 categories of steps, so to speak. So really the first step is identifying the dilemma. That's really, and that encompasses step 1 and 2. The next category I would suggest is evaluating or deciding upon alternatives to consider, right, relative to the research that you're doing. And then finally, making a recommendation to yourself and acting on that recommendation. So I think these 9 steps are important, but to make it more digestible for you, categorizing it with identifying the problem, talking about alternative solutions, and then making a recommendation is really the 3 kind of categories of steps to help you, better remember that. Okay, so let's have a quick discussion here. What do you find preferable about this 9-step process, but also what is not preferable about it? What are some limitations to this, applying this process to you and your work that you do on a regular basis? Let's quickly talk about that. And you could throw an answer in the chat box or just unmute yourself and tell us what you think.
So what I think is cool about it is it allows for a community health approach. And just a brief definition, public health is more of a top-down, do we make it the law? It's the right thing to do. People will follow the law, but that can create a bunch of resistance. So in community health, we would use things like community-based participatory research, and we can work with this community of people who don't have a high vaccination rate, find gatekeepers, et cetera, and then generate interventions that are designed by the community that will have greater community buy-in, et cetera.
Right. Yeah, and I think that's a great point. There's when you're making decisions on a broader context from a public health perspective, you certainly have to follow this process. From an individual, from a more micro, any sort of, I guess from a micro level, you also have to consider this process as well, because interventions that you apply to your patients, you really have to consider and go through this 9-step process to ensure that you are honoring those ethical principles and evaluating them effectively relative to the alternative options that you're giving your patient. There's a few things in the chat box here I want to. So yeah, good. Let's see. So a few comments. I like these first 2 comments because this is my major qualm with the 9-step process. Kathy noted, may make more time than I have at the moment to answer as needed. Right. Christy says, doing the 9-step is time consuming and practice. I guess maybe you're meaning not practical. Good, and I agree with that. Sometimes you have to make split decisions. And so you can't, when you're there and, in a room with the patient, you can't just kind of go through this process and say, hold on a second, let me go through the 9-step process of ethical reasoning before I give you my answer. Could you imagine? That would be really funny. And I think that should be acknowledged. So sometimes you have time to take a step back and go through this process, but often ethical decision-making has to be made on the fly. And so there's a few suggestions that I have, to address this challenge. Let me find my notes here. So you can always ask, so let's say you are approached with some kind of situation. You can always ask for more time to make a decision. So you can always like, leave the room, hey, I'll be back in 5 minutes, and quickly deliberate with colleagues. That's not a problem, right? In fact, I think, patients would generally appreciate the fact that you take them seriously enough to kind of take a step back and deliberate, and then, or do some research. Maybe you need to gather some more information and see what the literature says. So you could, request or tell a patient, hey, I'm going to, study some of the literature and then come back to you with a more informed answer, because I value you as a person, and I want to make sure that I'm giving you the best information available. So that's always something you can do. I mean, if you're still getting pressured by a patient or a colleague, like I think, one of the most kind of cliche ethical dilemmas that we face in the workplace is a colleague trying to pressure us to be dishonest. That's one I've used in previous trainings. And, you can always let a patient or a colleague know, well, you pressuring me makes me feel uncomfortable. Can I please take a step back and think about, what you're asking me to do, and then, come back to you in a few minutes. And oftentimes, making a comment like that is enough to help alleviate the situation. And your coworker might say, you're right. Maybe I shouldn't be pressuring you to make a decision so quickly. The same would go for a patient as well. So I think you always, in terms of this, the practicality of this 9-step process, it's important to consider that at times it may not be practical, but you should always try to give yourself more time if you have a certain level of uncertainty regarding the decision you should come to. You don't want to make quick decisions on the fly. I found this to be true, in my teaching as a professor. I've had students ask me questions that I don't know the answer to, and my first inclination, kind of that first human response, would be, well, I don't want the student to perceive me as not intelligent, and so, and I feel like earlier in my teaching, I would do this. I would give an answer on the fly because I didn't want to be perceived as not the expert. And as I've been teaching, and I've been teaching for about 7-8 years now, I've come to the conclusion that that is the worst, least ethical way of approaching those situations, because it's selfish, right? It's all about me, and I'm not being perceived as a non-expert. And I have found that, when I'm asked a question that I don't know, I take a step back and I go, hey, I don't know the exact answer to that question. I'm going to research that and get back to you in our next class period. I think the same, and so the same applies, thinking about that God complex as a nurse or as a physician. We don't want to be perceived as a non-expert. That kind of hurts our pride. And so, telling the patient, I don't know the exact answer to that question. I'll get back to you after I gather more information and perhaps go through this 9-step ethical reasoning process, and then you can get back with a better answer. And that is really the best thing from my perspective and a personal experience, that you can do in those kinds of situations. Okay, Alex noted, I think that it's a good framework for discussion. The limitation would be not every dilemma falls in these categories. Yeah, that's a good point. There are other ethical principles to consider. So I appreciate that comment there, Alex. Good, we have some agreement there. Greg notes, depending on the individual rules and laws in that state or county, the process would be limited to your possible actions. May not be applicable to the process. Yeah, exactly. If we were, in European countries that don't practice federalism, that have more of a top-down model, where they either make mandatory or vaccines mandatory or not, then there would be more of a consideration for ethics. Whereas in some situations relative to the state you live in, there's differences. Good, yeah, so Greg also said if we can slightly change the scenario, COVID-19 vaccinations are not currently mandatory, right? Would it be ethical to limit any air travel to only those who can prove they have been vaccinated? Yeah, and that's a discussion going on in state legislators throughout the country right now. I think New York is considering the potential for that, and other states will consider this as well, and it will likely be a conversation at the federal level. So yeah, stay tuned for that discussion. And I certainly will be following it because I think it's incredibly interesting. Any other thoughts in terms of this decision-making process before we move on? Okay, I want to give the class a chance to actually apply this decision-making process. I appreciate your participation in that. So even though there are some limitations, I think it's important to at least try it out and simulate it in a case study experience. Hold on a second, I see oh good, yeah, so Emily has posted that case. So please download it now before you enter your breakout rooms, because I understand that once you enter the breakout room, then you are not able to download it. So please do that. You're gonna read the case of John. I really like this case. Take about, in the interest of time, we're gonna just do about, yeah, let's go ahead and do, well, I think we can do about 15 minutes for this case instead of 20 minutes. So take the time to read this case and discuss go through the decision-making process with your group. And then if time, there are some discussion questions as well. And then we'll take 10 minutes to discuss as a class. So Emily, whenever you're ready, we'll break out into our rooms. Let's go ahead and tackle this case. And so it seems like you didn't quite get through the whole process of this decision making, which is fine, right? That means you're being deliberative and you're, taking each step seriously, which is awesome. And so let's chat about. Let me bring up the questions and the settings here. So we've already kind of talked a lot about principles. So I want to hear about if you made it to step 4. So a lot of you started focusing on considering alternative solutions. So I'm curious what some of the thoughts were from the group in terms of considering, as you went through this process, what were some alternative solutions that you arrived at as you went through this ethical reasoning process?
This is Lee representing room 4. We talked about a feeding tube, which was not a very popular solution, but one that we all thought was a very good one was to schedule a visit with his dog.
Right, so I appreciate this comment here. Often, like when I talk with my students and we talk about this decision-making process, we highlight the fact that it's important that you consider all of your alternatives, right? And to not just, I guess, totally brush aside one alternative from the get-go because you don't like it. So like the feeding tube, that's maybe not the most ideal option, but certainly one that should be considered, at least in terms of being fair in the process and maybe running that alternative through your evaluation, thinking about it from the prism of ethical principles. But yeah, so you also talked about bringing in his dog. I think a couple other groups talked about that as well. Other thoughts, alternatives? Thank you, Lee.
Well, we talked too that maybe he can write. Has anybody asked him to write something down, or give him some kind of tablet so he could communicate?
Yeah. So at this point in time, the staff has only tried, at least from the case description, has only tried one form of communication with this patient. And so perhaps there's other means of communicating with this patient that would be more comfortable to them, or might be more ideal in these circumstances. Yeah, great thought. Good. So this is from MMI12. Was patient competent, missing false teeth, spend time with patient for better understanding, possible writing if no verbal communication. Yeah, very good. Yeah, thank you for that sentiment relative to some of the other thoughts there that were shared. Other potential alternatives that can be considered in this case?
Molly had in the comments too, but just asking questions like, does he have dentures or does he have the proper equipment to even be eating those meals?
Good. Yeah. Oh, so let me make sure I'm following the chat here. Okay, good. Yeah. Yeah, that's a great point. So, and thinking about dentures, right? Is all the equipment there available to make the consumption of food orally comfortable for this patient. I think that's important. Yeah, so has anyone taken time to work one-on-one with him to find what the real issue may be? Others, I think another group noted, I think this was in the last group I was in, we were talking about the food choices and how oatmeal is detestable to some people, which I don't understand. Oatmeal is so delicious. I have it like every morning. Or applesauce. Yeah, I know my kiddos sometimes don't prefer applesauce. I understand that. Yeah, so thinking about alternative food choices, it seems like they maybe have tried that, but you know, sometimes you have to be creative and think about those aspects as well. Any other alternatives that we can consider? Okay, good. So let's move on. So what about let's kind of come to these next steps here. You know, in terms of evaluating the alternatives, in this particular case, what do you think is the most important ethical principles that we consider as we evaluate these alternatives, whether it's bring in the dog or to try different food or to focus on equipment or, you know, have a one-on-one discussion? I think another group noted, you know, bringing in other specialists, installing the feeding tube. What are some of the, what ethical principles do we apply in terms of evaluating the, you know, the value of these alternatives? Good, thank you, Greg. What does the patient want should be primary. Good, so, you know, valuing that respect, and putting that in ethical terms, you know, valuing the respect for autonomy. Thank you. I also didn't see this comment from Rosemary. Thank you, Rosemary. How about the friend, the friend who could visit? Yeah, that's a great alternative option there that's hadn't been considered yet. Non-malfeasance. Josie, can you elaborate? I know you're typing comments. Can you elaborate on what you mean in terms of applying that principle? Other thoughts? Josie elaborated, we want to assure he is fed to stay well. Yeah, exactly, right? So, you know, in terms of the notion of doing no harm, you know, it's important that he can continue to stay well. You know, and this, I think, as we noted in reading this case, at least from the initial standpoint, some of you may have saw this situation as more dire than it maybe actually is, right? And that there are, you know, practical solutions that can be done here. Good. Okay, let's see. Let me just, any other thoughts in terms of ethical principles that we apply in this case? Kathy, go ahead.
Well, I just think it comes back to, I guess Greg said this too, but so as the caregivers, we want him to eat. So we feel good about the fact that we've fed him proper nutrition. But what's his definition of wellness right now? And does he see that as something that he wants? And one of the things that when I went back and reread, and we talked about this in our group, when did this start for him? Because if you go back and read, he has a yard, he has a dog, he went to the neighbors for dinner, and then somewhere along the line, there was a few days that the neighbor didn't see him. She knew where the key was. She went into his house uninvited, one could say. I mean, you could argue that she knew where the key was, but at the same time, it isn't like he called out, come in. She goes into the house. How do we know that this wasn't a plan he had put in place maybe weeks ago? Maybe he's had everything in line. There's just so much we don't know.
Is not putting a feeding tube in ethical if you don't know if he wants to not eat? Look at it the other side. Is letting him waste away and die through inaction of not putting in a feeding tube an ethical evaluation if you don't know the situation?
Yeah. Thank you both for those comments. Other thoughts? I think those are really interesting comments. So just Bethany noted, yeah, depression in the elderly can manifest as delirium, certainly. You had other Other comments or responses in connection to those comments there?
One thing to think about is drug interactions in the elderly. If he's out of a prescription, or if the dosage is incorrect, or if he hasn't taken them correctly, these can be side effects of what he's taken. He's 92. Without knowing his pharmacological situation, it may be totally curable and treatable.
Right. Yeah, thank you, Greg. And those are some good points. So, yeah, obviously, there's a number of issues that we need to consider, right, in this particular case, right? What does he actually want? What was the context by which he came to our institution in the first place? Was this an attempt to end his life, right? So we need to understand, really some of these contextual issues before we make this decision. So that really gets to the gathering information stage. And I think one of the groups noted that stage 3 and 4 to them were kind of the most important stages, right? You really need to focus on gathering all the right information in this process so that you can make the most ethical decision that honors the autonomy of the patient, that does no harm, that actually provides a benefit to this patient and gives them the treatment that they want and deserve. And so, in thinking, and I appreciate all the sentiments on this case. I feel like your groups did a very nice job of thinking through this case. That information gathering step is really important. And so I hope as you move forward in your practice that you consider the importance of not making knee-jerk decisions. And this is something that I stress to my students, like in my ethics class, is some of the most unethical decisions are unethical because they were made so quickly and as a knee-jerk reaction to a particular situation. And so I invite you to avoid those kind of knee-jerk reactions and to be methodical, to gather information so that you can make the right decision. So a lot of you know very good questions that are unanswered in these case details. So that's really a good strategy to focus on, is what do we not know, and can we get answers to those questions that we don't know? And that will ultimately improve the ethical reasoning that you go through as you go through this process. Any other thoughts? We're kind of at an hour here since we last started. Other thoughts relative to this case that anyone would like to share before we take a break? Okay, well, great discussion. I appreciate your participation. So let's go ahead and take, let's say, if it's okay with you, about a 5-minute break this time instead of 10 minutes, so that we have time for our last remaining segment of our training today. So we'll go ahead and come back together at 12:25. So we'll see you in about 5 minutes. Thanks, everyone. Okay, well, I see that Emily's back and others of you have joined as well. So welcome back to the final segment of our training. We have about 35 minutes left. Appreciate all of you sticking with us for this whole training. It's just really nice to talk about these issues with you in this great setting here. So thanks for sticking with us, and excited for this last segment here. So let me just share my screen so we can get going. Okay. So you did our break. All right. So just a quick thought experiment. And in this last thought experiment, I don't want you to share. You don't have to share your answer in the chat box. But have you ever read your field or perhaps your organization's code of ethics for which in the organization for which you are employed? You don't have to answer this, but think, back in your memory, have I ever read my field? So if you're in nursing or if you're a physician, have I ever read, or in public health, my field's code of ethics or my organization's code of ethics? Maybe you did at some point in the past, but you kind of forgot about what it says, or maybe you did it during the onboarding process when you're being fire hosed with all sorts of new information. And so it's just one of those, policy documents that you have to read when you're onboarded. So just think about that and how familiar you are with those codes of ethics. So in the last, obviously in the last couple of hours, we've talked about different approaches to ethical decision making, teleology, deontology. We've talked about ethical dilemmas. We've differentiated between ethics, morality, and the law. We've talked about the 9 principles of ethics in healthcare. We've talked about the 9-step decision-making process as well. In this last segment, we're going to talk about the professional codes of ethics that apply to your work as healthcare professionals. I see a comment here. So Kathy, FYI, the Montana Board of Nursing has some awesome free CEU modules that discuss the nursing practice. Thank you, Kathy, for sharing that. Okay, so let's just briefly talk about, so let's get into this. So what is a code of ethics? So if you're unfamiliar with this, I think it's worth defining it so we understand what a code of ethics is. So a code of ethics are statements that define the duties of healthcare workers, the virtues they should hold, the certain principles espoused by employees of their profession or organization, and the outcomes of ethical principles, if ethical principles are followed. So does your profession have one? Well, if you're a physician or a nurse, yes. If you're in other fields, likely it does. Does your organization have one? Likely. You should look into that. And do you know what it says? Hopefully. Now, I would probably suggest that 80% of you probably don't know what it says, and that's okay. The point of this training is to get you thinking about these things and get you excited about understanding ethics within the context of your profession. So let's talk about 2 examples. And as I review the provisions in these codes, I invite you to pay close attention to how they apply to you specifically in your work. So from the American Medical Association, the AMA, and I would suspect that for some of you, this is a code of ethics that you have become familiar with. It just so happens that there are 9 principles of medical ethics. There's actually a whole manual that elaborates on these 9 principles. And so we're going to go through the 9 principles kind of in raw form. But you can, and I'll put in the chat box at the end of our meeting the link to the AMA Code of Ethics, so that you can actually read the manual if you would like. So their preamble goes as follows, and I think this is a great preamble. The medical profession has long subscribed to a body of ethical statements developed primarily for the benefit of the patient. As a member of this profession, a physician must recognize responsibility to patients first and foremost, as well as to society, to other health professionals, and to self. The following principles, and yes, you guessed it, there are 9, adopted by the American Medical Association are not laws, but standards of conduct that define the essentials of honorable behavior for the physician. So you'll notice here in the preamble that they make a distinction between, legal and ethical, right? And I think that's important to note. So here are the first 3 principles, and I've highlighted, I put just a few texts in red, just to highlight, and I'm not suggesting that these are the most important, but in my mind, relative to our conversation so far in this training, something to make note of, or worth making note of. So number 1, a physician shall be dedicated to providing competent medical care with compassion and respect for human dignity and rights. A physician shall uphold the standards of professionalism, be honest in all professional interactions, and strive to report physicians deficient in character or competence, or engage in fraud or deception to appropriate entities. So you'll notice there that there is as part of the standard of professionalism, actually reporting lack of competence or engaging in fraud or deception is also part of your ethical duties as a physician. A physician shall respect the law and also recognize the responsibility to seek changes in those requirements which are contrary to the best interest of the patient. So not only is this third provision in noting that part of acting ethically is obeying the law, but also when there are deficiencies in the law, there's an ethical responsibility to seek changes in the best interest of the patient. So within the context of public policy, a physician has an ethical responsibility to basically lobby for their patients, so to speak, according to this code of ethics. Principle 4, a physician shall respect the rights of patients, colleagues, and other health professionals, and shall safeguard patient confidences and privacy within the constraints of the law. A physician shall continue to study, apply, and advance scientific knowledge, maintain a commitment to medical education, make relevant information available to patients, colleagues, and the public, obtain consultation, and use the talents of other health professionals when indicated. This is a really interesting provision, particularly this idea that a physician should continue to study. This is kind of an ethical principle in my field. Of course, I'm required to publish or perish as faculty of the University of Montana, and so obviously I'm feverishly publishing as many articles as I possibly can. But it's an ethical responsibility of myself to continue to study so that I can have the most relevant information for my students. Similarly, for you, being current in the field is an ethical responsibility so that you can best serve your patients as well and be familiar with the best practices and treatments in your field. Number 6, a physician shall, in the provision of appropriate patient care, except in emergencies, be free to choose whom to serve, with whom to associate, and the environment in which to provide medical care. Finally, our last 3 provisions, and Emily, if you would be so kind, I have the PDF document with these 9 provisions. If you wouldn't mind sharing that in the chat box, that would be awesome. We will be using these for our next case. Number 7, a physician shall recognize a responsibility to participate in activities contributing to the improvement of the community and the betterment of public health. So this is really interesting, and this is kind of a broader responsibility of a physician to engage with the community and to, oftentimes I think we think about, like I can think about the context of my job, from the individual interactions I have with my students, but certainly my responsibility goes much further than that to educate and provide the expertise I have about public policy and ethics to the community at large. Number 8, a physician shall, while caring for a patient, regard responsibility to the patient as paramount. And finally, number 9, a physician shall support access to medical care for all people. And so these 9 principles of medical ethics, certainly I think many of you, whether you're a physician or not, can find some relevancy in applying these principles to your work. I would argue that being familiar with these principles and looking into them further you would find a lot of utility in doing that and understanding the AMA's code of ethics. Now, for those of you who are nurses, I want to make sure this is relevant for you. There are 9 provisions of the code of ethics for nurses, and this is no joke. So yeah, 9 is kind of our lucky number today. Provision 1. The nurse practices with compassion and respect for the inherent dignity, worth, and personal attributes of every person without prejudice. So you can see how some of these provisions connect very specifically to the principles of ethics that we discussed in hour 2. This, of course, provision 1 connects well with justice that we talked about. Yes, and Emily just shared the provisions of medical ethics and the provisions for the Code of Ethics of Nurses. So both of those documents are downloadable. I invite you to download them because we will use them in our next case. Thanks, Emily. Provision 2, the nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. Provision 3, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. So I think it's really interesting that these codes of ethics, note that it's not just the role of a physician or a nurse to protect the rights of patients or to provide the right treatment, but also advocate and be an advocate for patients. You know your patients best. You know the struggles that they faced, and so you certainly can play an important role as a kind of a mouthpiece for those patients in terms of advocating for public policy and other policies within your organization that can best benefit your patients and honor their rights. Was there a comment here that I missed? Okay, yeah, and there's the mini case. Awesome. Okay, provision number 4. The nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to provide optimal care. Provision 5, the nurse owes the same duties to self as others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. So just like our last code of ethics with the AMA, the ANA, the American Nurses Association, notes that nurses also have an ethical responsibility to develop themselves professionally, right? To stay current with the field. And you guys are doing this by participating in this 4-hour professional development training on ethics. And you should continue to do those things to enhance your personal and professional growth, to allow you to be a more ethical and competent nurse and physician. Provision 6, the nurse through individual and collective action establishes, maintains, and improves the moral environment of the work setting and the conditions of employment conducive to quality health care. And finally, our last 3 provisions. And I hope as we're going through these together as a class, that you're seeing the practical application to your work on a day-to-day basis. Provision 7, the nurse, whether in research, practice, education, or administration, contributes to the advancement of the profession through research and scholarly inquiry, professional standards development, and generation of nursing and health practices. So again, that responsibility to advance the profession and arrive at better ways of doing what you do on a day-to-day basis. The nurse collaborates with other health professionals and the public to protect and promote human rights, health diplomacy, and health initiatives. There's so much we could say about this statement, but it's important that as professionals in healthcare, you collaborate, that you're not doing your work in a silo, but that you're interacting, deliberating with other health professionals to improve the work that you're doing and the interactions you have with patients. And finally, provision 9, the profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice in nursing and health policy. So again, I think this is an important provision, thinking about maintaining the public trust. When you act with integrity, with ethics in mind, you're able to maintain the public trust, help the profession, and basically forward the profession of nursing itself and what nursing does in a more effective way in terms of improving health policy and those policy goals overall. So I know that's kind of a lot, and these are some loaded statements, and that's why, we don't have time within the constraints of this training, but that's why I encourage you, I'll put these links in here once you go off into your case, I'll put the links up so that you have the links for these codes of ethics available to you. But I encourage you to go and read these codes of ethics more thoroughly in terms of their interpretive statements and the manuals that they provide in context to these statements. However, I think it's important that we take some time to try and apply these statements to a case to give us a little bit of practice. Consider these provisions in the applicable code of ethics as you read the mini case out loud with your group. And this is a shorter case, so it shouldn't take you as much time. Emily will again take, let's see, how much time do we got? So this is an interesting case, and I'm wondering what your thoughts are in terms of, what are, I guess, thinking about like assumptions, right? And you may not believe the self-diagnosis of a patient that comes to you, right? In this case, it's from the parent of the child. And so, what can a code of ethics, how can a code of ethics, like one of the code of ethics that we just read, help inform us in terms of navigating this situation? I think that's the main question I want to address in thinking about this case.
So practicing compassion and respect for the culture. So pretty much 1, 2, and 3. Kind of
Good, yeah.
Yeah.
So how would we do that? How do you, so like in thinking about applying that provision, respecting the culture, what does that look like in tangible terms? So, you know, obviously like the code of ethics is telling us we should do that, but like, what does that look like in reality?
So for me, if I were dealing with this patient, I would be completely open. They would have my undivided, I would be listening. I would say nothing that would upset them. I would try to learn more about this culture, maybe before the patient came in, just so that I knew, you know, because some cultures don't like to be touched. Some, that's okay. You know, those little things. And yeah, just being really open to that, and having no pre-imposed you know, thoughts about that culture.
Yeah, good. So kind of letting go of any preconceived notions that you have, and actively trying to understand how the patient is approaching or dealing with this situation, right? And I think that's very good advice there. And so yeah, so in terms of applying that principle of respecting culture, it's a matter of being open-minded, and even though you might have preconceived notions, or you might you know, already have an idea of what the diagnosis should be, you know, providing that active listening ear is a matter of ethics, right? It's demonstrative to your patient that you're responsive to them, you're accessible to them, and that would be the more ethical way of going about it, instead of quickly imposing your view or diagnosis on that patient without considering their wants or desires. Good. Other thoughts in terms of how we apply? Oh, go ahead.
I think as well that that continuing education piece in professional development, if you're working in a largely Hispanic community, you know, taking the action to learn more about that culture, this might come up again, or is there another provider that can speak, you know, to how they've dealt with the situation? If, yeah, I don't know. I think that you can learn about that culture as part of your professional development and continuing education as well in this scenario.
Yeah, thanks, Abigail. That's a great thought. And I agree. I think part of professional development is not simply like reading all the scholarly journals you can in your field. I can do that in my field, and that'd get boring after a while, really. You know, it's yeah, studying the individuals that and the cultures and the perspectives by which they are coming to your office, and having a better understanding of that, I think, is part of professional development. Let me make sure there was, let's see, so much of your efficacy as a provider, so this is from Bethany, of healthcare hinges on respect and compassion for your patients and is necessary for therapeutic relationship. Yeah, well said there, Bethany. And I agree. I think that definitely corresponds with some of the principles in our in the code of ethics that we looked at. Greg mentioned must be very aware of any language barrier with differing Spanish dialects. Yeah, well said. You know, and I actually like speak Spanish myself. I lived overseas for a couple of years, and oh, I tell you that the language barrier can significantly impact the perceptions in terms of what is actually being said. You know, I remember one time being overseas and saying something completely bad that people were like in shock, and I felt so embarrassed because I didn't realize I said a horrible thing, and you know, all these you know, some of these guys from you know, were kind of laughing at me because I said something totally like crazy, and so yeah, I mean, there's that language barrier, and you know, we need to you know, really do all we can in our power to ensure that you know, we understand completely what is being articulated to us by our patients. Yeah, so communication, Kathy noted, is key. Asking lots of questions and listening to the patient. Yes, thank you. Well said there. Good. Other provisions that we might apply to this case from the codes of ethics that we reviewed. Good. Yeah, it seems like we noted several there. You know, I would just you know, again suggest that this idea of professional development and thinking about, I think one of the groups noted that, these patients actually might be right. What the condition that this patient is experiencing, the diagnosis given by the mother actually might be correct. And so, again, I think that again ties into this idea of continually educating ourselves as is part of acting more ethically within our professions. We have to continue educating with each unique experience that we have. We can better improve the way that we practice nursing or practice being a physician or in public health or whatever field we're in. Just a few concluding thoughts. Thank you for those comments. Just a few concluding thoughts I want to give as we tie up our training here this afternoon. Oh, I see one chat here. Let me make sure I include it here. Hold on a second.
It's just me.
Oh, just okay. Okay, so just a few concluding thoughts. Ethical decision making starts with you. So you've attended this training, and that does, give you the chance to impart some of this wisdom to your colleagues. And so I encourage you to make ethics a part of the conversation. Don't tackle ethical dilemmas alone. So you now know what a dilemma is, right? When you have competing principles at play. Have open communication with colleagues. Consult your institutional ethics board if there is one. Always ask yourself, would my decision be perceived as unethical? So, after you come to a conclusion, think about that idea of impropriety and the appearance of impropriety. Would my grandma be okay with this if this was reported in the news media? Consider what my duties are as an employee of my organization or in my profession. What virtue should I have? What principles should I operate from? What are considered the best outcomes for my work in terms of principles of healthcare ethics? Locate your organization's code of ethics. I really encourage you to do this. Read it, commit to using it, and take time or take charge in improving it if there are some improvements to be made. If your organization doesn't have one, take part in creation and training. One of you noted that we should have continual trainings. That's important. So yeah, make ethics a part of department meetings, invite employees. If you're in a supervisory role, invite an employee to take 5 minutes to discuss one provision in the ethics code, whether from your organization or profession. Have a brief discussion, and again, make it become a part of organizational culture. That's really ultimately how we want. This is a great training, and you spent 4 hours. Kudos to all of you. Tackling ethics today in our training. But ultimately, what would be my greatest hope is that you continue this conversation in your sphere of influence with your colleagues. I really hope that you spend time to do that. So with that, I'm going to pass things over back to Emily, but thank you all. It was a pleasure to interact with you today, and I hope you took some tangible skills and ideas with you to take with you after our training. Emily, go ahead.
Thank you so much, Adam. That was fantastic. In the chat box, I've put our evaluation link, very valuable for us. It helps us to keep offering awesome content. It's short. If you want nursing CEs for this webinar, you have to fill out the evaluation. And then to know who you are, shoot me an email and I will send you a certificate. So my email address is in the chat as well. That's been the easiest way, so I know who needs a certificate and who doesn't.
Emily, I also threw in just below your comments the links for the code of ethics for the AMA and the ANA. So those are there. Please, maybe save those links when you get the chance. But yeah, please take the evaluation survey.
Thank you. I'll be sending out slides and the resources again to you later as well, just so you have them. Thank you so much and have a wonderful, hopefully sunny afternoon.